Hey everyone, Chris here from MedPrep2Go, and I wanted to let you know about our premium Step 2 Bundle podcast, which gets you all of the Step 2 secrets and our Step 2 Questions podcast combined and ad-free. You'll also get early access to all of our Step 2 Questions episodes before they're released public. The bundled podcast is available now, and you can save over 40% with an annual plan. Details at medprep2go.com. Do you need a break from studying? Check out the Dr. Raj podcast, where he discusses topics such as wine with Jesse Katz, sarcoidosis with Bob Saget, saving the bees with Sydney S. Sill, and so much more. The podcast also features guest host Becca Spar, who focuses on leadership and connection, as well as Dr. Michelle Kulai in her Everyday Rooms segment, where she talks to patients to share their stories and the challenges that come with different conditions. Just search for the Dr. Raj podcast wherever you're listening now and tune in for a variety of great guests and topics. Hey everyone, Chris here from MedPrep2Go, and welcome to another episode of our USMLE Step 2 Questions podcast. In this episode, I'll be reading 3 ENT questions from our online Qbank, which, as a friendly reminder, of course, you can read all of these questions and more at medprep2go.com. And with that being said, let's get started with question 1, ENT 4. A 52-year-old man presents to his primary care physician with complaints of recurrent episodes of severe vertigo, hearing loss in his left ear, and a constant ringing sound in the same ear. He also reports a sensation of fullness in his left ear and episodes of nausea and vomiting during the vertigo attacks. These symptoms have been occurring intermittently over the past several months. He has taken meclizine without improvement in his symptoms. Past medical history is significant for hyperlipidemia, for which he takes atorvastatin. Vital signs are within normal limits. Physical examination reveals that the external auditory canals are clear and the tympanic membranes appear normal. The remainder of the physical examination, including a neurologic examination and Dix-Hallpike maneuver, is unremarkable. Which of the following is the most likely diagnosis? A. Acoustic neuroma. B. Benign paroxysmal positional vertigo, BPPV. C. Labyrinthitis. D. Meniere disease. Or E. Vestibular neuritis. And the correct answer is D. Meniere disease. Meniere disease presents with hearing loss accompanied by severe vertigo, tinnitus, a sensation of ear fullness, nausea, and vomiting. These symptoms are characteristic of this inner ear disorder. Acute treatment includes vestibular suppressants, such as benzodiazepines or anticholinergics, like scopolamine, and antiemetics to help with the nausea and vomiting. Lifestyle modifications, such as salt restriction, limited caffeine intake, and limited alcohol consumption, should be continued indefinitely. Vestibular rehabilitation is important, and pharmacotherapy includes beta-histine and diuretics. Answer choice A, acoustic neuroma, is incorrect. Acoustic neuroma typically presents with unilateral hearing loss and tinnitus, but vertigo is less common and usually not as severe as in Meniere disease. Answer choice B, benign paroxysmal positional vertigo, BPPV, is incorrect. BPPV presents with brief episodes of vertigo triggered by changes in head position without hearing loss, tinnitus, or ear fullness. Answer choice C, labyrinthitis, is incorrect. Labyrinthitis can cause vertigo and hearing loss, but it is usually associated with a preceding upper respiratory infection and does not typically present with a sensation of ear fullness. Answer choice E, vestibular neuritis, is incorrect. Vestibular neuritis presents with vertigo and nausea, but does not typically cause hearing loss or tinnitus. Key learning point. Meniere disease presents with hearing loss accompanied by severe vertigo, tinnitus, a sensation of ear fullness, nausea, and vomiting. Question 2, ENT 5. A 72-year-old man presents to the emergency department with severe right ear pain for the past 2 weeks. He describes the pain as deep, constant, and worse at night. He reports purulent ear drainage and decreased hearing on the right. His medical history is significant for poorly controlled type 2 diabetes mellitus. Vital signs are within normal limits. Physical examination reveals granulation tissue at the floor of the external auditory canal and marked tenderness with manipulation of the auricle. Cranial nerve examination shows mild right-sided facial weakness. Which of the following is the most appropriate next step in management? Is it A, high-dose intravenous cefepime, B, oral amoxicillin clavulinate therapy, C, placement of a tympanostomy tube, D, topical acetic acid eardrops, or E, urgent mastoidectomy? And the correct answer is A, high-dose intravenous cefepime. This patient's presentation is classic for malignant otis externa, a life-threatening infection of the external auditory canal that can spread to the skull base. It occurs most commonly in elderly patients with diabetes or in immunocompromised individuals. Severe otalgia out of proportion to exam, granulation tissue in the external auditory canal, cranial nerve involvement, especially facial nerve palsy, and purulent otorrhea are key features. The most common causative organism is Pseudomonas aeruginosa. Management requires prolonged high-dose intravenous anti-pseudomonal antibiotics, such as ciprofloxacin, cefepime, or piperacillin tazobactam, often guided by cultures and imaging. Answer choice B, oral amoxicillin clavulinate therapy, is incorrect. This regimen is appropriate for uncomplicated otis media, but does not adequately cover Pseudomonas and is insufficient for invasive disease. Answer choice C, placement of a tympanostomy tube, is incorrect. Tympanostomy tubes are used for recurrent or chronic otis medias, not infections of the external auditory canal. Answer choice D, topical acetic acid eardrops, is incorrect. Topical therapy alone is appropriate for uncomplicated otis externa, but is inadequate for malignant otis externa with skull base involvement. Answer choice E, urgent mastoidectomy, is incorrect. Surgical intervention is rarely first line and is reserved for cases refractory to medical therapy or with abscess formation. Key learning point: malignant otis externa presents in elderly or diabetic patients with severe ear pain, granulation tissue, and possible cranial nerve deficits. It requires prolonged intravenous anti-pseudomonal antibiotics. Question 3, ENT 6. A 3-year-old boy is brought to the pediatric clinic with 2 days of fever, irritability, and tugging at his right ear. His mother reports that he had an upper respiratory infection 1 week ago with nasal congestion and cough. Past medical history is negative. Vital signs show a temperature of 38.9 degrees Celsius, or 102 degrees Fahrenheit, but are otherwise normal. Otoscopic examination of the right ear shows a bulging erythematous tympanic membrane with decreased mobility on pneumatic otoscopy. The left ear is normal. Which of the following is the most appropriate initial management? Is it A, high-dose amoxicillin therapy, B, intranasal corticosteroids, C, oral antihistamines, D, reassurance and observation only, or E, topical antibiotic eardrops? And the correct answer is A, high-dose amoxicillin therapy. This child has classic acute otis media characterized by acute onset of symptoms such as fever, ear pain, and irritability, middle ear effusion, and signs of inflammation such as a bulging erythematous tympanic membrane with decreased mobility. AOM, acute otis media, commonly follows a viral upper respiratory infection which leads to eustachian tube dysfunction and bacterial superinfection. First-line treatment for uncomplicated AOM in children is high-dose amoxicillin, which provides adequate coverage for the most common pathogens, including Streptococcus pneumoniae, Haemophilus influenza, and Moraxella catarrhalis. Answer choice B, intranasal corticosteroids, is incorrect. Intranasal steroids may be used for allergic rhinitis but do not treat bacterial middle ear infections. Answer choice C, oral antihistamines, is incorrect. Antihistamines do not improve outcomes in acute otis media and may cause adverse effects such as sedation. Answer choice D, reassurance and observation only, is incorrect. Observation may be appropriate in select older children with mild symptoms, but this patient is young and has significant fever and exam findings consistent with bacterial AOM. Watchful waiting may be appropriate for children over 6 months of age with mild symptoms. Answer choice E, topical antibiotic eardrops, is incorrect. Topical drops are used for otis externa or for otorrhea in patients with tympanostomy tubes, not for uncomplicated AOM with an intact tympanic membrane. Key learning point. Acute otis media presents with fever, ear pain, and a bulging, immobile tympanic membrane. First-line treatment in young children with high fever, severe pain, or symptoms lasting longer than 48 to 72 hours is high-dose amoxicillin. And that will conclude this episode of our USMLE Step 2 Questions podcast. I hope you enjoyed it and found the information useful. Please be sure to follow us at MedPrep2Go on LinkedIn, Facebook, Instagram, and YouTube to stay up to date with our content. You can learn more and read our other Step 2 questions at medprep2go.com. Happy studying! Hey everyone, Chris here from MedPrep2Go, and I wanted to tell you about our MedPrep2Go Step 3 review podcast that features over 90 episodes and 40 hours of high-yield content from Dr. Ted O'Connell and Dr. Raj Dasgupta. This is a premium podcast that has already helped over 100 students pass their exam. You can learn more and subscribe at medprep2go.com. Hey everyone, Chris here from MedPrep2Go, and I wanted to ask you to please follow us on social. There may be links in the show notes, or you can find us at MedPrep2Go on Facebook, Instagram, LinkedIn, and now YouTube. We would greatly appreciate it as we try to spread the word about MedPrep2Go and keep medical education accessible and affordable.